Recently, we've had a lot of new clients come to our offices here at Sojourn. And what I wanted to do is provide a bit of information for people who are coming to their first ever session with a psychologist. Often it can be a little bit off-putting, or people don't always know what to expect from us. So I thought I'd give a little bit of an introduction that I often find I give my new clients so that you can have an idea of what would happen if you did come in to see us. So let's say you're going to see a psychologist. You've been feeling down, you've been feeling really depressed lately, and you talk to your friend and they say, oh, there's this great psychologist over at Sojourn, and it really helps. You should really go talk to them. And you think, first of all, well, no, what is it going to do to help me if I tell somebody about my problems? I mean, what are they going to be able to do? And things go by and maybe they don't get any better, and so you kind of go back to your friend and you're like, hey, what was the name of that place again? I just I need to do something. So you give us a call and you make an appointment and you end up with the name of somebody, maybe Tony or Tara or whoever, and maybe you cruise the website to see kind of what they look like, so you kind of have some idea. But then that's kind of where the information stops. So what do you expect when you come in the door for your first appointment? Maybe you dig out all the movies you've ever seen with psychologists in it and, watch a few of them and then decide, well, obviously they're either going to be, a serial killer, or they're going to be a ridiculous quack, or they're going to be dull and monotonous and, the one that the main characters always avoid. But, you decide, okay, well, I'm going to keep my appointment anyway. So when you first come to our offices, it's very much like a medical office in terms of, come up to the desk and check you in, and, they'll get you to sit in one of our waiting rooms. And shortly after, the psychologist should come down when it's time for your appointment and bring you up to their office. Generally, when you first arrive, we get you to fill out a more in-depth consent form with information such as, what kind of medications are you taking? What's your main concerns? Just lets you flesh out your worries so that the psychologist can be better prepared. There's also the consent form on the back that lets you know about our policies, our procedures, our confidentiality policies, just so you're aware of everything that applies to coming to speak to a psychologist. Once you're in the psychologist's office, we will usually, sit you down and go through the consent form again and make sure you have no questions and make sure everything makes sense to you. And then there's a few directions it can go from there. For example, sometimes people need the whole space of time to tell us what's going on. And that's okay. If you've been carrying around a lot of stuff with you for a lot of years, you're going to need time to build the story and explain to us how everything fits together. And for some people, it's cathartic just to get everything off of their chest in one session in 1 hour. And that's okay. As a psychologist, I would ask questions if I needed more information. I take notes specifically to record things that are important that I remember for our next session. And basically, my interest in that moment is to figure out, what is important, what do you feel is important that I know? Other people will come in and they'll say, okay, this is my problem. I need to learn how to manage my anxiety better. Or I need to, get out of bed and go to work because I'm really having trouble with that. And again, that's perfectly fine. You may be very much to the point. We might get into strategies right away. We might not. But there is no right way for it to look. The important thing for you to be aware is that as a psychologist, I'm going to be pretty aware of the information that I need, and I'm going to direct as needed, and I'm going to focus the session so that I get the most information from you as that is possible. So you don't need to feel the stress about maybe not telling me the right thing or covering all your bases. As a psychologist, we've got that. And then, after you've had a chance to explain what's going on, we might get further into it. We might start working on strategies. we might discuss some treatment options going forward and then just give you some time to evaluate what you'd like to do. Depending on the problem, you can usually expect to want to book more than one appointment. As a psychologist, I probably won't know at the first appointment how many, but I can give you a general idea of maybe how far apart the appointments could be to help us get going fast enough. But we do our best to be responsive to what you're able to do financially, time-wise, everything like that. So that is basically what to expect out of your first visit to your psychologist. And hopefully this helps to reduce some of the trepidation that can be there because of this new experience you could be putting yourself out for. And hopefully, the ending to your story is that we're able to find techniques that will work for you, and we're able to talk through things, and you feel supported, and you feel that you can handle what you're facing, and you're able to move forward feeling better about life in general. So hopefully that was helpful. And I will continue next time with my sessions on explaining basic mental health diagnoses. Have a great night.